All right, so now that we've gotten that started again and done our introductions, we will go ahead and turn it over to Nancy Groves for an overview. I'm just going to go ahead and share my screen so that everyone can see the presentation that she is going over. Can everyone see that? Look good, Nancy?
It looks good, yes.
Good.
I need to apologize because there's some hammering going on downstairs. It should be finished in just a second. Can you guys hear that?
Yes.
You can hear the hammering?
Oh, no, I mean, I thought I meant can you hear you. We can hear you. Not too bad.
Okay.
Yes.
All righty, you can move forward. So as Kelly said, I'm an advisor at the Fauquier campus, and most of the programs that I advise are related to health professions. So I just want to give you an overview of what we have at Lord Fairfax. There are two different types of degrees that you can receive at Lord Fairfax. One is an applied degree, and the other is a transfer degree. Today, I'm really going to be focused on the applied degrees that are leading to a particular skill that are in relation to the health professions field. So, as I mentioned, an applied degree would lead to, they're typically 2 years, and then it would lead to a skill that you would then take into the workforce. There are also some different kinds of credentials that you can earn at Lord Fairfax. One is a certificate or a career studies certificate, which are just less than a degree. And then the other is what we call a credential. And you can earn a credential through Workforce Solutions, which is the non-credit side of Lord Fairfax Community College. And I'll talk about that too. I also wanted to just point out two different things. We have clinical types of degrees, and then we have non-clinical. So clinical actually just means working with patients hands-on directly. Non-clinical might be working in the medical field, but you're actually not having direct patient care. So you can move on to the next one. So we have, just to highlight some of the degree programs that we offer on the clinical side, we have a degree in dental hygiene. And I don't think we have someone specifically talking about dental hygiene today. So I can just share that it is a 2-year degree. It is what's called a competitive admission program, and most of the health professionals programs are competitive, which means you have to apply separately to those programs and be accepted into those. And I'm sure the program leads will talk about what are the requirements to be eligible to apply to those programs. Dental hygiene is only offered at Lord Fairfax every even year, and it's a joint venture that we offer with Virginia Western Community College, which is another school in Roanoke, Virginia. And the labs and all the coursework is done at the Middletown campus. We also have an EMS degree. That is a 2-year degree as well that leads to different certifications within the emergency medical services field. So you can have an EMT or basic certification, advanced EMS certification, as well as paramedic. And we have a med lab tech program, which is also a 2-year degree. And Professor Gokenauer will talk about that. And we have a nursing degree, and that leads to, we have 3 different tracks you could potentially do for that. It's an Associate of Applied Science in Nursing that leads to an RN, or you would become a registered nurse if you complete that program successfully. And we also have a Practical Nursing Certificate, which leads to an LPN. On the non-clinically, we have the Health Information Management degree, which is more the back end where you're working with medical billing and coding. Okay, next. Thank you. Okay, and these are just highlighting the certificates. As I mentioned earlier, a certificate is just less than a degree. Typically, it's like a year-long program. So we did have, in terms of emergency medical services, that degree can be broken down into different certificates of EMS, advanced, and paramedic. There's also a nursing assistant course that leads to a certified nursing assistant, or CNA. Patient care technician, phlebotomy, CSC, which is when you go to the doctor and you're actually getting the tourniquet put on and they take the blood, that's called phlebotomy. So we have a certificate in that, or actually a career studies certificate. And then practical nursing I mentioned earlier. Right now, surgical technology is considered a certificate in our catalog, and Professors Putnam and Day will discuss maybe what might be transitioning in that program. On the non-clinical side, we also have a lot of different certificates that are related to the medical billing and coding. And then we have a couple of stackable certificates, which means you can do some of the coursework on, for example, on the pre-allied health career studies certificate. A lot of those courses within that are prerequisites for many of our health professions programs. So you can earn a career study certificate while you're doing prerequisites for our competitive health admission programs. And then the health science certificate would be the next bump up, or another stackable credential or certificate that you can earn as well. And let's see what's next. Credentials. Okay, credential would be something that you can earn, sort of a skill you can earn through our Workforce Solutions department. Workforce Solutions is the non-credit side of Lord Fairfax Community College. You don't have to apply to the school. Well, rather, you don't have to meet certain criteria in terms of the credit side to be able to take these courses. They're more of a class that you can sign up for and just earn more of a fast track skill, leading to a certain kind of credential. And there's quite a few that are in the health professions fields. We have also a CNA course, medical assistant, leading to a certified clinical medical assistant, phlebotomy, pharmacy tech, dental assisting, which is a fairly new program that we're offering, and that's very popular. Medication aid, CPR, and first aid. And on the non-clinical side, there are some very similar ones in terms of like health information management and the coding, medical billing and coding. Okay. And then just wanted to mention, there's a lot of resources that we offer at Lord Fairfax in student services. We have free tutoring. You always can meet with an advisor. This is unusual. Now we're doing our appointments through Zoom and by phone. Walk-in tutoring we have available. So just a lot of resources are there for new students. So that's just a quick overview. Thanks.
So thank you so much for that overview. That was perfect. So now we're going to turn it over to our faculty members, beginning with Kate Gokenauer with MedLab Tech.
Hi, how are you? So am I talking about the program right now, or?
Yeah, please discuss the program, potential career opportunities in the area, salaries, admissions requirements, all of it.
Okay, so I teach medical laboratory technology, and as I said, it is a 2-year Associate of Applied Science degree. So it is actually 5 semesters long. There's a semester of prerequisites. Once you complete those, you're eligible to apply to the program. And then once you're in the program, there are 3 semesters of didactic work, which you complete at the college. And there's both lecture and labs for that. And then there's a semester worth of clinical externship. And I typically like to tell my students that this is a 14-week job interview, because most of the time, by the time they're done 40 hours a week for 14 weeks at one of the local hospitals, they have a job waiting on them. So a little bit about the degree itself. So MLTs are the people that perform all of the testing on body fluids and tissues and specimens and just about any body fluid you can imagine. And the statistic that I always share is that over 75% of a patient's diagnosis and treatment relies on lab testing alone. So this is huge. They say that without us, doctors are just guessing, which is somewhat true, because if you go to the doctor with a sore throat or a fever or anything else, they're going to do a throat swab, they're going to draw your blood, they're going to try to figure out what's going on with you. But we are behind the scenes. So a lot of times when you're thinking about any health professions, you don't really think about the behind the scenes people. So your x-ray techs, your med lab techs, your respiratory therapists, any of those, you typically think about the nurses and the doctors and the people that you physically see. The median salary for this degree is $51,000 a year, which is a little bit higher than what we do in this area. When you graduate from this program, and like I said, most of the time you have a job waiting for you, the starting salary is about $40,000 to $45,000, which is still really good. One of the best things is that we have a career ladder. So you can start as a phlebotomist, or you can start as a specimen processor. And this is just doing the hands-on testing. You're not doing the testing, I'm sorry, the hands-on processing of the specimens. So when the specimens comes in, you check the doctor's order, you check to make sure it's the right specimen. So you start as a phlebotomist, start as a processor, work while you're going to school. After you graduate, you've graduated with an AAS degree, or Associate of Applied Science, and they offer bridge classes from an associate degree to a bachelor's degree. So once you get your job as an MLT, you can go back to school and get your MLS degree, which is your 4-year degree. And then you can even go on to master's degree or a doctoral degree or anything. A lot of techs actually go on to med school, and there is an entire year, so 2 full semesters of med school, that if you are an MLS, you can skip that. So you actually get a year of your MD taken away from you, that you don't have to do schooling. And one other thing to think about, this kind of covers all of the programs that you're going to hear about today. But I'm sorry, I lost my train of thought. Once you do get your job, a lot of employers, a lot of hospitals offer tuition reimbursement. So you get a job working as a tech, and they will actually pay for you to go back to school and get your 4-year degree.
Thank you so much for sharing that. That's such a huge resource for anyone who's able to work with their employer. And thank you for telling us more about MedLab Tech. Next, we're going to turn it over to Lisa and Tina with Surgical Technology.
Turn your mic on, Tina.
So Lisa Day is going to start off. We're going to switch hit. She's going to talk to them about job opportunities and pay scales.
I'm up first. Okay. First of all, to understand what we do in the operating room, we actually are, a surgical technologist is responsible for creating and maintaining the sterile field for our surgical patients. We are an integral part of the surgical team. We work directly with the surgeons and with our RNs. We are scrubbed up to the field, and we're the ones that are responsible for the instrumentation and anticipation of how the case is going to go, and providing everything that the surgeon needs, sutures, the medications up on the field that need to have the procedure go with the best outcomes. So we're in it's a unique field because the labor market, I was looking up what the labor statistics are in the US, and I don't think they really are real accurate for our area, but because Virginia is so diverse, Southern Virginia versus Northern Virginia there's a huge disparity between the economic levels there. But according to the labor statistics, it states that Virginia techs start out, the median range is between 44 to 47,000 per year. I kind of beg to differ with that because where we're located in Virginia, we're very unique as far as we're more rural, but a lot of our healthcare organizations are, their wages are more towards the DC and Northern Virginia area. So in DC area, the median range is 55 to 67,000 a year. Nationwide, it varies, of course. In our program, you sit for a national certification exam that qualifies you to work anywhere in the United States. Virginia is not a mandatory certification state. However, there are many states around us that do require that national certification. And, depending on where you go, your wages can go up and down. So it just kind of depends. The really neat thing about our students is, like what Ms. Gokenauer said, with her students in clinicals, our students are usually hired at their clinical sites. They're on a year-long job interview, and which is really, it's great because the clinical sites get to know you, you get to know them, and a lot of our grads actually get to pick and choose where they go to work, which is nice. And I will tell you, our grads last year in the area of facilities, I can tell you per hour, started anywhere from 20, 25, even more per hour, depending on the organization and the demand. As we know, healthcare is being really taxed right now. And while there's a dip in the need right now, I really anticipate that when we get over the whole coronavirus and the pandemic, our surgical cases are going to start going through the roof, and there's going to be a huge demand. And so the job outlook is really great, especially here in Virginia. I think there's less than 2,000 surgical techs in the state of Virginia, which is pretty amazing with all the healthcare facilities and all the cases that are done here. So that's about all I have to say about that. Yeah, you can ask me a question later. There you go, Tina.
Our program right now, we're finishing up our last certificate program. We are moving to an associate degree, and we're hopeful that we will begin with this fall. That's our plan. We're waiting on one of the state's accrediting bodies to come back with our final approval, and it all looks very well, like it's going well right now. We are making this change because our accrediting body is requiring that every accredited program move to an associate degree. So if you want to sit for the national certification test, you have to have completed an accredited surgical technology program. So it has to be a 2-year program. It's also very beneficial to the student. It'll help with job growth. There's so many benefits to it. We're really excited about it because I think the transition will have shorter classes, shorter students in classes for labs, more time to spend on it. So I think it's a good move for all students. We have just posted the TEAS testing online. So students still have until June 10th to register and take that TEAS test before we admit students. We'll admit 12 students on the Middletown campus and 12 students on the Benton Hill campus. We do have prerequisites for this program too, and started running those courses, the first one being SUR 100, Introduction to Surgical Technology. We started that this spring, and we plan to run that course every semester. Thank you, and you can ask me questions later.
Yes, absolutely. And speaking of questions, we do have some coming through in the chat that are being answered as we go. So feel free to send us questions through the chat, or wait until the end to send more through chat or talk with us just verbally. So now that we've gone over surgical technology, thank you, Lisa and Tina. We are finally going to turn it over to Amanda for nursing.
Hi, everybody. I'm Amanda Brooks. I'm the program lead for the Fauquier campus of the nursing program. We have nursing on the Middletown and the Fauquier campus. Hopefully you guys can hear me. I know my internet is not fantastic, and I have to hold my phone close so you can hear. So nursing is, there's been a nursing shortage for 30 years or longer. I know as long as I've been a nurse, there's been a nursing shortage. There's especially a nursing shortage now. We, some years you can jump right into some of the high-tech specialties in nursing, and some years you start on the medical or surgical floors and then work your way up to some of the more specialty units. Beginning salary for nurses working day shift is about $27 an hour in this area. Kind of depends on where you're working, what unit you're working on, and then usually there is a shift differential for working evenings, overnight, weekends. So that helps boost your salary. Everybody's kind of talked about tuition reimbursement, and that is something that you see a lot. The RN program here at Lord Fairfax is a 2-year associate degree program. We recommend that you go on for your BSN or your bachelor's degree, and then hopefully on for your master's and potentially your doctorate. And once you get a job as a nurse, then your facility will help to pay for that. Some of the facilities do require that you become, or that you earn your BSN within a certain number of years after you start working. Most places it's 3 to 5 years, so you have time after you graduate from us to get your bachelor's degree. Our program is a 5-semester program. 1 semester is prerequisite that you can do all in 1 semester, or you can take your time working through those. Once you get into the program, if you are a traditional student, it's 4 semesters. You start in the fall, and fall, spring, no classes over the summer. We also have a track we call it the Advanced Placement Option track, or APO track. That is for students who are LPNs who want to come back and get their RN. Those students start in January and go for 3 semesters plus their 1 semester of prerequisites. So let's see, the Advanced Placement Option students apply over the summer and find out in the fall whether they've been accepted and start in January. The traditional students apply in the spring and find out usually in April whether they've been accepted, and then they start in the fall. And there is, I know we'll have questions and answers at the end, but there are 2 information sessions that are being held on Zoom, through Zoom, that are specifically for nursing. You can find out if you go to lfcc.edu/nursing. You can look for the information sessions. One of them is tomorrow night, or tomorrow at 4 o'clock, and then May 20th at 4 o'clock as well.
All right, thank you, Amanda, so much for sharing all of that about nursing, and great to hear that there are nursing-specific information sessions as well. So I'm going to go ahead and just check the chat to see if any new questions came through. Looks like not, but again, we want to open up this time for Q&A. Just to give you all some time to think about what you might want to ask, I do want to just repeat the question that was asked on chat in case it'd be beneficial for anyone to hear, and then allow Nancy to provide the answer that she shared just in case anyone else is interested in the program mentioned. So someone was asking about becoming a radiology tech for their OBGYN and wondered which program that would fall under and how to achieve that. So again, Nancy, could you share with the group the answer to the question that you gave?
Sure. So sometimes that means different things to different people when you say radiology tech. So I can answer the question that I think you're asking. Northern Virginia Community College has a radiography program, 2-year degree. That's a competitive program, but there are prerequisites for that. So you can certainly do the prerequisites at Lord Fairfax, just making sure that you are taking the equivalent course that they need. I believe that Mary Washington Hospital offers a program, and Valley Health. And it's my understanding that both of those programs require that you have to come in with an associate's degree. So we do have an appropriate transfer degree or that would work for something like that, where you can build into that degree the specific prereqs for that program. So that's a great way to do it. There may be some other ones, but those are the ones that come to my mind. But I'm also wondering if you're asking about maybe something like diagnostic medical sonography. That's another kind of branch of that where you're a sonographer doing sonograms for an OBGYN. So that might be something, since you mentioned OBGYN, I'm wondering if you're thinking of that. So I know that Piedmont Virginia Community College offers that program. Nova does as well. And then I think Valley Health may even have a specialization in that. I'm not positive, but you can certainly, again, do prerequisites at Lord Fairfax if you're interested in pursuing something like that. Does that help? Is that good?
Oh, I think it's great. Sorry, I didn't know if you were asking the potential student or parent if that was good. I actually think it's great, and wanted to follow up with that, Nancy. Let's say somebody doesn't know exactly what they want to do. They all sound like great options. Can you talk a little bit about what an advisor might do with a student in a one-on-one session to kind of go over their different aspirations?
I think one of the first things is, there are a lot of people that want to get into nursing. And so usually I will kind of talk about what the job entails. I worked as a nurse myself as well, so I can kind of relay some of my experience working as a nurse and kind of bring a little bit of a perspective that maybe some students might not have thought about in regards to maybe patient care and what the workload is like and things like that. So we usually discuss that, but then I'll also try to give the students an idea of what some of the courses are, in particular anatomy and physiology. That's one of the harder courses that you're going to be taking. It is a prerequisite for, I think, almost every program that we're talking about today. If it's not a prerequisite, it's part of the program. And that is usually a difficult class for many students, and they really have no idea that, well, not all of them, but some will go into that not realizing the amount of work that course involves. So that's a discussion that we will usually have on the very front end. And you may not want to do a full load of courses, 12 credits with anatomy being part of that. We usually might stretch that out and try to take, maybe go part-time while you're doing some of these prerequisites. So the course load is something we talk about, the content, the study time that's required. Are you able to take these classes while you're working and being a family person, a mom or dad or whatever, all that's involved. But typically we will go through sort of a rundown, kind of like we did today, of what each of those fields look like, and then kind of go from there.
Fantastic. Thanks so much, Nancy. So we'll give the rest of you an opportunity to go ahead and ask your questions. Again, you can do it with audio or you can do it on the chat. We'll just give you a moment to think about what you might want to ask. Okay, I actually do see a question, and whoever wants to answer can answer. It says, in regards to tuition reimbursement, is it the standard $5,250? And again, whoever feels that they can answer that.
Go ahead, Lisa.
I think, I'm not sure what that question is asking. As far as tuition reimbursement from employers, that is, I see another question coming across, but that's really up to the individual healthcare facilities and what their need is. A lot of times, if there is a shortage in a certain field, they'll funnel more funds towards that field and not necessarily others. So it just really depends on the field and the facility that you're looking at. So it's not really a standard. It's kind of, you know, I've worked for organizations where they have a $10,000 reimbursement and others that might give you $300 for books a semester. So it just depends on where you're going and what you're doing.
Thank you, Lisa. That was great, kind of having the real world experience there to help us out. Kate, were you going to add to that as well? I couldn't tell who that was.
No, that's exactly what I was going to say. She covered everything.
Fantastic. Well, we actually have another question that came through that is for you. I don't know if you can see it. Mine just got blacked by an email. There it is. It says, would the county EMT course, which I'm looking into, help me to prepare for a potential nursing degree? I'm a volunteer fireman right now.
That's a good question. It helps and it hurts. A lot of people who come into nursing have experience in healthcare in other areas and move into nursing. And every branch of healthcare professions has their own way of doing things, looking at things, thinking about things. So when you come into nursing, you learn how to do the nursing process, which is different than an EMT or a firefighter or a surge tech or a med lab tech. We all look at problems differently. So a lot of your knowledge transfers over and makes some of nursing school easier. And a lot of your knowledge is very different and makes pieces of nursing school a little bit harder, unfortunately. In the end, does it hurt? Does it help? You probably helps you a little bit. In the end, it's just trying to change your way of thinking from the firefighter and EMS way of thinking to the nursing way of thinking is difficult sometimes.
All right, looks like we had another question come in for nursing. It says, is it advised to get phlebotomy certification along with RN?
No. It depends on where you work. Some places you will never start an IV or never draw blood because there are people from the lab who come up and do all of that, and they have IV teams that start the IVs. Other places you might draw blood if the lab is busy, but it's not such a big piece of your job as a nurse that you would. It's a lot of time and a lot of money to get another certification that you don't necessarily need.
Thanks for giving prospective students an idea of what to expect. Amanda, we appreciate you. I was wondering, Nancy, if you could again touch on what we sometimes call stacking credentials, like thinking about those pathways. Like Amanda said, maybe it might not make sense for someone to do phlebotomy and nursing, but could we talk about some things that would make sense for a student to do in terms of stacking those credentials?
Sure, and Amanda, Dr. Brooks can chime in here as well. But we do have a nursing assistant course, and that is directly related to nursing, and I think it's a great way to find out if this is really the field you want to get into. And sometimes there is a period of time before you can actually submit an application to the nursing program where you're working on your prerequisite courses, and you may be able to fit in a workforce credential course for nurse aid, and then you can actually potentially use that skill while you're in nursing school. Maybe working weekends or evenings or something like that. But then also prior to that, you're able to determine, is this really a good fit for me? Is this something you'll be able to be in in that environment and actually see what a nurse is doing and actually have direct patient care and learn certain skills that you'll need as a nurse as well. So that's a great one to do if you have the time to fit that in. We have some non-clinical certificates, the pre-allied health career study certificate and the health science certificate. Those are more on the academic side, but you certainly can stack those and begin earning something while you're working on the prerequisite courses. I think it's nice to be able to earn something, even if you don't get admitted into one of our competitive programs. At least you can earn something. And while it doesn't give you a skill, it may help you with a job. If you're maybe against someone else who has no college course credit, you have something that you can show you completed a certain number of credit hours at a community college. So it could help in that way. There are the other credential programs through Workforce are clinical medical assistant. That's, I think, also somewhat related to nursing, where you could potentially work in a doctor's office and learning how to take blood pressure and the height and weight, temperature, all those, the vitals, basic things like that are going to help you. I think that will help you definitely in even just having patient interaction, how to handle that. Dr. Brooks talked about phlebotomy not being as relevant. The only thing that might be helpful is if you needed a skill while you were in school, that may be something you could utilize at a lab or something while you're in a program like nursing. General assisting is also a great one that the Workforce, we talked about it earlier, Workforce Solutions offers that now. There is, as I mentioned, our dental hygiene degree is only offered every even year. So that's quite a gap of time, but you can certainly do something like dental assisting while you're taking prerequisites and getting experience. And for that program, it is rather vital for you to have contacts who can give you references, and you have to have a certain number of observation hours with a registered dental hygienist. So that would be another great credential to receive.
These are fantastic, Nancy. Thank you so much for each of those resources. And just so you all know, you can find all of these programs at lfcc.edu/explore, which I'll go ahead and real quick type in the chat so that you all can find it any time. In addition, you can learn more about those programs either through more information sessions or by talking to an advisor like Nancy. We're going to go to our next question. It isn't directed towards one specific program, so I'll ask it for everyone. What is the, oh, I'm sorry, it says, what is Nclex pass rate? So I'm guessing it is for nursing. What is the Nclex pass rate and how competitive is it to get in? And just since we are on the topic, maybe after Amanda talks about that for nursing, we could talk about the competitiveness for the MLT and Surge Tech programs. So Amanda, take it away.
Okay, the Nclex pass rate varies from year to year. Our goal is always to have a pass rate that's at least the state average, and we aim for the national average, which is sometimes a little bit higher or lower than the state average. Last year, the Fauquier campus pass rate was 91%, which was very good. We've had pass rates in the mid to high 80s to low 90s over the past several years, so we're very happy with that. The competitiveness of the program, and this is probably true for all of the health professions programs, it really depends on how many applications we get. We only have a certain number of spots. We have 24 at the Fauquier campus and about 80 every year at the Middletown campus. So we can take total about 100 students per year into the traditional track. This year we had 160 qualified applicants for those 100 spots. Last year, I think we had 145 qualified applicants for the 100 spots. And the year before that, we had about 120 applications for the spots. So it depends on the year. With nursing, the one thing that really drives your success in getting into the program is your scores on the admission test. So there is a minimum or a benchmark score that you have to meet, but the higher you score on this admission test, the A2, the better your chances are to getting into the program. So we really recommend if you take the entrance exam and you are close to the minimum, that you study and take it again a couple months later to try to bring those scores up.
Good. All right. How about Surge Tech for competitiveness?
It depends on the year, just like she said. Some years it's extremely competitive, some not so much. We take 12 on each campus, so that's very helpful. And a lot of students will they'll either apply and not take the T's. If you are very interested and meet all the requirements, do everything's expected, your chances are extremely good.
I'd like to add though, with that, there's still requirements. So even if we take 12 on each campus, if we only have 8 qualified applicants, that's all we'll take. We have a standard of requirements that come in. But so yes, it's competitive, but you know, the maximum we can take is 24, but we might only take, you know, 11 total in one place. So it just depends on the qualifications.
Very true.
All right, and then how about for MLT?
So the same thing as for nursing and surge tech. We are competitive, but it's based on the year. And I don't have a whole lot of statistics to offer through LFCC because we are only accepting our second cohort at this rate. We do have it capped at 10 spots. And I can already tell you for the incoming cohort that will start in August, we have a lot more than 10 applications. So this year especially will be more competitive. We do want to see a GPA of 2.5 for the last 12 credits. So this is a lot of times the telltale on whether or not you get accepted. You have to do the prereqs, you have to meet all of the requirements, and the last thing that comes down to is the GPA.
That's really good to know. This is great advice. And we actually have a specific question about requirements for nursing. It says, are the prereqs math, science, English, etc., or are they nursing specific? My daughter went to Dowell J, but I'm unsure of how the board will make the students take the exam with COVID-19.
Okay, so I guess I'm confused about the question. Is the question about the prereqs for nursing or about how Nclex is operating with COVID-19?
It's about the prereq for nursing.
Okay. So the prereqs for nursing, it's your SDV, your student development course, English 111, Psych 230, which is developmental psych, Bio 141. You also have to take 142. We encourage you to take it before you get into the program. It has to be completed by the first semester. And then you get a choice of public speaking, theology, or English 112 as your 5th prerequisite course.
Gotcha. In regards to like the Dow J, I just try to make up like one question. Are any of the prereqs waived if she gets her CNA?
No.
No. Okay.
Oh. Nancy, are any? Yes, I'm not familiar with the CNA prereqs. If there are any that are.
So you have to meet a certain math requirement and have English readiness to take the credit side CNA course. Is that what you're asking?
Sorry.
Okay, and that particular course, you could also work on the patient care technician career studies certificate. And as you begin to, if you earn the CNA, then you can receive credit for that. That's within the patient care technician. So that's one of those where you can earn another certificate in addition to your CNA license.
Would the PCT help her with a radiology tech?
Depends on the program. Are you asking if the patient care tech would help with getting into a radiography program?
Correct.
It depends on the prerequisites for the radiography program, but I wouldn't necessarily say that you have to have that to apply to a radiography program.
Gotcha. But would it help?
I can't answer that really because I don't know how they make their selection.
Gotcha.
I know you have to meet certain courses, and oftentimes there's an admission test as well. So, but she may be able to do some of those courses within that patient care tech.
Gotcha. Thank you.
Mm-hmm.
I wonder, just looking at the name, I'm guessing it's Jeremy, is that right?
Yes.
Okay, hi Jeremy. So a thought that I had maybe, if in the chat you want to provide your email to just Nancy, she may be able to send you some links to those radiography programs so that you can kind of begin looking over them. And one thing that we offer as well is a general inquiry meeting, sometimes with advisors where you could just have a brief one-on-one chat over the phone. So that's one thing to think about. Kind of moving forward to get you as much information as possible. But again, if you just want to provide your email address to Nancy privately in the chat, she could probably send you those links.
All right. Thank you, Kelly.
You're welcome. All right, so I've been checking the chat. I don't see any other questions listed right now. So again, I'm just going to give you all a brief moment to either ask questions that you might have that are remaining via audio or type them into chat. So we'll just wait a moment and then we'll see how we're going to move forward. All right, I'm not seeing any questions right now. Oh, there we go. Perfect. All right, so last question that I see right now, and again, bring more in if you want to. This person says, will there be, oh, good. Yes. Will there be a session for the social sciences like this one? We don't have one scheduled yet, but I can make that happen. So if that's of interest to you, anyone on here, along with the person who's asking, we can make sure that we get something set up online for you all that you can attend. And that would be with Larry Friedenberg, if you've ever heard the name. He's the lead of our human services program and teaches several of our sociology courses. In addition to the one that we're offering now and potentially a social sciences session, I do know that we have in the works IT, and that's going to be on the 11th of May. So that's going to be cybersecurity, computer science, information systems technology. We have a recreation and outdoor leadership session in the works, and we have a business session in the works. So there's a lot to look forward to. There's also going to be a session coming up on May 18th about kind of non-traditional paths to higher education. So whether you are an adult that's been in the workforce for a while and you're thinking, I can't attend classes during the day, what options to have available, or online learning, even transferring and getting your four-year university degree online after going to LFCC, or maybe even getting credit for the work that you've done in the workforce. So that's all coming up aside from the specialized session today. I'm just going to see if there's any more questions real quick. I see a thank you. You're very welcome.
Kelly, you're muted.
Sorry, I said Jessica, I muted you on accident. Again? Jessica, unfortunately, it's really staticky. Maybe try putting it in the chat and then we can answer from there. I apologize. Let's see, typing away. All right, there we go. Thanks for understanding.
Yeah,
Yes.
let me.
Go for it, Amanda.
I have the up, so let me just post a link in the chat.
And just for those of you who are listening, the question was in reference to the nursing information session that's occurring tomorrow night and then the one that's occurring later next month. So Amanda's just going to send the link to you all here. Thanks, Amanda.
Sure. Okay, so I put the link for tomorrow's session. It's at 4 o'clock, and then how you can find the links to future sessions.
Good. Amanda, we can talk about this more later, but if you and the nursing department wanted, we could also promote it on our social media pages so you get even more participation in the sessions.
Okay.
All right, do we have any other questions? And I'll just wait just a moment. Okay, so I guess what we can do for now is just end the session from here. But again, just know that in the 50 years that LFCC has been open, your future has always been our focus, and that has not changed. So feel free anytime to reach out to me. I'm Kelly Williams, Michelle Cribbs, who also co-hosts with me Tuesdays and Wednesdays. Amanda, Lisa, Tina, or Kate, we're all here to help you. This session is going to stop recording soon, and we will send you a follow-up email just giving you additional resources. Everyone have a good night.
Thank you. Have a good night.
Bye.